As more states are legalizing marijuana, experts say there are some health risks people should think about.
9 on your side's Taja Davis takes a look at a new study and what it means.
One of the more troubling health effects to consuming marijuana is the risk of having a psychotic episode. A new study published in the Lancet Psychiatry shows that consuming weed on a daily basis and using high-potency cannabis is associated with a higher risk of psychosis.
During an episode of psychosis, an individual might have altered perceptions, their thought processes might be different, and they might lose contact with reality completely. For example, they might have hallucinations where they're seeing things or hearing voices, or they might have false belief systems.
The study found those who used weed daily were 3 times more likely to have a psychotic episode compared with someone who never used the drug. Use of high-potency weed every day almost doubled those odds.
And it gets even worse that if people who use high-potency marijuana have a 5 times greater odds of having a psychotic episode.
The study defines high-potency cannabis to have more than 10% THC. Dr. Trush says one theory that connects weed and psychotic episodes is that marijuana influences dopamine in the brain, a chemical that can affect hallucinations. But she and the study stress that there really is no conclusive link of marijuana directly causing psychosis.
Unfortunately, marijuana has been classified as a Schedule I substance by the federal FDA and thus hasn't been studied completely. We would greatly benefit from having further studies done so that we could completely understand what marijuana is doing to the human body and mind.
According to the National Alliance of Mental Health, as many as 3 in 100 people will have an episode at some point in their lives. Taja Davis, KGUN 9 on their side.